This is Tim Horn. I am the editor-in-chief of AIDSmeds.com, and I am here at the 2008 joint meeting of the Interscience Conference on Antimicrobial Agents and Chemotherapy and the Infectious Disease Society America annual meeting. The methicillin-resistant Staphylococcus aureus, also known as MRSA, is an antibiotic-resistant bacterial infection that is becoming an increasingly more common problem, notably in people living with HIV and AIDS. Dr. Nancy Crum-Cianflone is a researcher with the Tri-Service AIDS Clinical Consortium and a staff physician at the Naval Medical Center in San Diego. We will be talking with Dr. Crum-Cianflone today about MRSA, especially as it applies to people living with HIV. Dr. Crum-Cianflone, thank you for joining us.
Thank you for the invitation.
First, let's just talk a little bit about what staph infection is, including some of the problems that it causes.
Sure. So Staphylococcus aureus, and we'll just probably call it staph here, is a common bacteria that's normally found on people's skin. And it usually does not cause any problems for the patients, except in the fact that if you get an abrasion or you have a wound or you have surgery, then those bacteria may go inside the skin and actually cause an infection. So the most common problems we see from staph infections are skin and soft tissue infections. Those include boils, cellulitis, abscesses. Those about 80 to 90% of staph infections that we see are these soft tissue and skin infections, and usually they're pretty mild overall. However, these organisms can also cause more serious infections, and that includes even spread through the skin into your muscle, can gain access to the bloodstream and cause infection of the lungs and heart valve. And we've seen these infections both in our HIV patients and in the general population. So it can result in a very serious infection in the minority of cases. We've also seen people with conjunctivitis due to MRSA now and other staph species, even a paronychia, a little toenail infection can be caused by these. And so that's the spectrum, but again, mostly skin and soft tissue, but can spread to the bloodstream and the lungs.
Okay. Now, with staph, that I'm assuming based on what you just said, that a lot of us do have this bacteria on our skin.
Correct.
But only a percentage of us actually will go on to develop an active infection from that?
That's correct. And if we swab people's nose, and the nose is actually the most common place people carry staph, if we would swab or take cultures of people's nose in the general population, about 30% at one point in time will be carrying some form of staph in their nose. If you look over time, an additional 30% intermittently carry staph. And so it's usually that there is a risk factor or something in addition, be it skin trauma or something else, that sets the person up then to maybe develop an infection.
Okay. Now, let's move on to MRSA. What is it about MRSA that makes it such a really significant and really dangerous infection?
So MRSA is methicillin-resistant Staphylococcus aureus. And so methicillin was a common type of penicillin that was developed actually in 1959. A couple years after its introduction, we noted that some staph species have now become resistant to methicillin, and hence we call that MRSA. Now, although that was discovered in the early 1960s, it really did not become a problem until about the 1970s, where in the U.S. we noticed that many of the staph infections occurring within the hospitals were actually now due to MRSA. So that was really just a hospitalized problem. But in the early 80s, it was discovered that we noticed some of these MRSA infections starting to occur in the community. Mainly this was the drug use community. And we didn't see anything further, and so we weren't really that concerned. But as I think everyone's aware, by the late 1990s, early 2000s, community-acquired MRSA, developing without hospital contact and without any drug use or any other risk factors that we could ascertain, started to occur in the communities. And we believe that this was due to the evolution of a new strain of MRSA that seems to have evolved in the community that has new virulence factors in addition to carrying methicillin resistance. So it's not so much that we think that it's the methicillin resistance that's causing so many people to become infected and severe infections. But when we look at the bacteria now molecularly, using genetic techniques, that those bacteria that's now getting the MECA gene, which is the gene that encodes for methicillin resistance, along with that is being carried virulence factors that we hadn't seen before. And it's these virulence factors that's now made it so much more common to get these infections, the necrotizing infections that we're seeing, the soft tissue infections, and the increasing rates that we're seeing in the general population and in HIV patients. And the predominant strain is called USA 300, that is carrying both the resistance to methicillin and these additive virulence factors that's made this such an important infection.
Okay, so it's just not so much that this infection, well, one issue is that the infection is drug resistant.
Correct.
But even more importantly, perhaps, is that it's actually a potentially more dangerous infection.
That's correct.
Okay, all right.
So it's more difficult to treat because you can't use your penicillins, which are usual drugs to treat skin infections because they're resistant. And now they have faster doubling times and they're more virulent than the normal staph that people had usually been carrying.
Okay, now let's bring this into HIV. I believe it was 2 years ago, in 2006, you presented some data that basically from the Naval Medical Center, where you work, indicating that the risk of MRSA is 18 times higher in people living with HIV. Have that been found in other studies? And why is this? Why are those infections more common in people with HIV?
That's really a great question. And so actually at this meeting, the ICAAC IDSA meeting of 2008, there's been 2 other studies that have compared during this meeting the risk of MRSA infections in HIV positive versus negative persons. And one of these studies by Popovic, who works at Cook County Hospital in Chicago, found that when they compared the rates, HIV positive patients were 6 times as higher. So the rate was about 9 cases per 1,000 persons in HIV positive versus in the general population 1 to 2 cases per 1,000. So about a 6-fold or higher risk of HIV. And another study done by the LA Veterans Hospital also found an increased rate. So these study results, I think, are consistent. The rate might vary a little bit. You know, is it 6 times? Is it 18 times? I think it's clear that HIV patients have a higher rate. It's showed by our studies and now reproduced by other cohorts, both in Los Angeles and Chicago. Now, the reasons why HIV patients might be higher is really unknown. Most of the work so far has been retrospective chart reviews. So it's really hard to know exactly what the risks are. But there have been risk factors described. And some of this has been described at this meeting and in previous work. Ram Sethi had a poster presented today on Monday at the meeting comparing HIV patients with MRSA and those without MRSA. And they found that people with MRSA had lower CD4 counts, were less likely to be on antiretroviral drugs, and had more antibiotic prescriptions. So I think that tells us that perhaps HIV patients might have a higher risk if they have lower immune systems. And that might be because they don't have as good a response to fighting this bacteria or containing it. It also might be that as your immune system drops, you might be more likely to get antibiotic prescriptions for other infections. And so I think clearly there's a component of the immune system and the increased development of these infections. In addition, I have to say that we wonder if some of it's not behaviors too. Not at this meeting, but previous meetings have suggested that number of sexual partners, a history of syphilis, and lack of condom use puts patients at higher risk. So I think there's some things that maybe as physicians that we can try to address to decrease the MRSA rates in HIV patients. And I think there's some advice that we can give to HIV patients in terms of not asking for antibiotic prescriptions unless it's really necessary because we know that heightens a risk, and safe sex practices. And just general good hygiene. I think all those are really good ways to try to decrease a person's risk.
Okay, thank you. This is Tim Horn. I am here talking with Dr. Crum-Cianflone about MRSA and HIV, and actually this concludes the first part of our interview. We'll be back with part 2.